Well, thank you, Mr. Chair, and I want to thank you and Ranking Member Murray for holding this hearing. And I also want to thank you for your work along with Senators Casey and Enzi to pass a reauthorization of the Career and Technical Education Act. This committee continues to be an example of really common sense bipartisan leadership. And I am happy to be here at this hearing to discuss the importance of apprenticeships and how we can ensure that these programs meet the needs of program participants and employers, something that I think you have all been unified in talking about today. To Ms. Vito, I want to start with this. One of the rationales that the administration has provided to create a whole new apprenticeship program alongside the registered apprenticeship model is related to the challenges of the registered apprenticeship model to serve non-traditional apprenticeship industries like healthcare and manufacturing. In New Hampshire, using an Apprenticeship USA state expansion grant from the U.S. Department of Labor, the Apprenticeship NH program has partnered with more than 20 employers to train apprenticeships in a whole range of fields. In addition, many of these programs offer post-secondary credits that students may use to achieve a more advanced degree going forward, ensuring that individuals are on that lifelong career pathway that we all want them to be able to have. I recently visited one of these employers in Manchester, New Hampshire, Granite State Manufacturing, that offers a registered apprenticeship program that trains employees to become machinists. These apprentices take classes for credit at Nashua Community College, receiving 20 credits towards a machine tool technology CNC programming certificate and or the Associate of Science degree in precision manufacturing. Ms. Vito, I know you have worked with more non-traditional fields yourself, specifically in healthcare, and you have explained already today how the registered apprenticeship model has benefits for employers and apprentices. Can you just take a minute, though, to talk some more about how you think the model of registered apprenticeships can expand to more sectors?
Yes, so first thank you, Senator, for the question. So first, I think we have to acknowledge the changes that have been made that have helped expand it. The competency-based model was what allowed healthcare apprentices to be registered, and that's a model that's been embraced by the U.S. Department of Labor. Rather than just rewarding seat time, it's acquisition of skill and demonstrated proficiency. Second, the multi-state registration has allowed us to register things at scale that you might not have in one location. And then the technical assistance grants, which you just talked about, have actually provided the opportunity for intermediaries and employers and unions to work together to build the capacity. Then I want to just note that there was a piece of legislation called the EARNS Act in 2016, introduced by bipartisan legislation, introduced by Ranking Member Murray and Senator Hatch. And it provided for the official establishment of the Office of Apprenticeship, competitive grants to build more capacity, increasing awareness of employers. I think it was said earlier, not by me, that there was misconception about how difficult the process is. It may be a rigorous process, but still one open to employers, and effective evaluation and other parts. So the EARNS Act, again, 2-year-old legislation, would help to expand this to non-traditional industry.
Thank you. I also just wanted to move to the area of healthcare for just a minute. You described in your earlier testimony the story of Destina Garcia, who participated in the Community Healthcare Worker Apprenticeship Program in New York City. She's on her way to a college degree. She's earning a living wage. As you know, we are facing a workforce shortage across the healthcare sector. One of those shortages and one of those sectors that's very personal to me is the shortage of direct support professionals who provide care to our seniors and individuals who experience disabilities. In New Hampshire, we estimate that 70 to 80% of paid hands-on care for older adults and individuals who experience disabilities is provided by direct care workers, including personal care aides, home health aides, and nursing assistants. And the demand for direct care workers is expected to increase 49% between now and 2022, further exacerbating a workforce shortage that already exists in many communities across the country. At the beginning of this year, Apprenticeship NH launched a pilot home health aide registered apprenticeship with senior helpers in Stratham, New Hampshire, in collaboration with Great Bay Community College. and now there are a total of 3 of these programs. I realize I'm running out of time, so I just wanted to quickly ask you to comment on how registered apprenticeships support participants like Ms. Garcia, and do you believe these programs are an important mechanism to address workforce shortages, particularly for direct support professionals and throughout the healthcare sector?
So I know we're out of time, but let me just make 2 points. One, home care workers are important sources of recruitment because they're diverse and they have a set of incredible skills,
Yeah.
Patients, what we call patient-centeredness, that are important for other occupations. So they are often apprentice in other occupations, which sometimes keeps them in the health industry longer. The second, in the actual health home care occupation itself, one strategy that we've used in the registered apprenticeship I think you're discussing uses is enhancing the skills of the home health aide to do more of what's needed in healthcare, like prevent avoidable hospitalizations. And as you use apprenticeship with a mentor on the job learning, you also can increase the wages of the home health worker in that model and help retain them, the workers in the industry.
Thank you, and thank you, Mr. Chair, for your indulgence.